Well, sticking with healthcare, New York Presbyterian President and CEO Herbert Pardes is the dean of the city's hospital establishment. He's the largest private sector employer in Manhattan and a thoughtful leader for the industry as a whole. He was ranked one of New York Magazine's top 12 most powerful individuals in New York City. Dr. Pardes, welcome to Bloomberg News. It's good to have you back.
It's good to be with you.
Dr. Pardes, what impact is this legislation going to have on hospitals?
Well, I think the first thing to focus on is the impact on individuals. And I believe there are a whole host of things that happen here which are very good news for people with regard to their health care. One is the elimination of pre-existing conditions, the elimination of lifetime caps, the increased portability of insurance, the increased coverage of people. So as far as I'm concerned, as a hospital's first purpose is to serve patients, and I think this is good news for patients.
But what is it? That's exactly what I was going to ask you about, Dr. Pardes. What is the impact for the hospital?
Well, I think the hospitals were forthcoming. American Hospital Association worked with Senator Dubaucus and volunteered the reduction of about $155 billion in costs on the assumption that there'd be some revenues coming in by virtue of more people being covered. That's the way this program works. Larger numbers of people covered, which enable the hospitals to accept cuts in their costs. And so on balance, I think the fact that people are more widely covered is good news for hospitals, because when people are not covered, I think they wait too long to come in for health care. They come when they're sicker. As a result, they need more and more expensive care. Often they're put in more dangerous situations. So I think anything that reduces the number of uninsured patients is good news.
But what about this idea we just asked our prior guest, this question about hospital consolidation? Because a lot of the benefits for the hospitals won't go into effect for a couple of years here.
I think hospital consolidation will increase. As you know, we merged two major hospitals, which was what created this very large institution called New York Presbyterian. And I think there are many efficiencies to be gathered and sharing of best practices so that the idea of integrated systems, not only hospitals, but relationships between hospitals and other parts of the health sector are in our future. We have just been developing a new relationship with one of the finest nursing homes in the country, the Hebrew Nursing Home, and I think those kinds of consolidations and collaborations are good for us.
Dr. Herbert Pardes of New York Presbyterian Hospital joining us on the phone. Dr. Pardes, thank you. Always good to talk to you.